Hello, and welcome back to the channel. You're in your public health community safe space, and as always, we are going to have meaningful conversation. So today, we're discussing a topic that many people often ignore. Yes, there is a public health crisis occurring, and it's occurring in your mouth. Yes, I said it. The public health crisis is occurring in your mouth. Today, we're at the dentist. And I'm going to share with you the fact that there are thousands, even hundreds of thousands of Americans walking around with a preventable condition that's existing and costing billions to fix once it's impactful. So, do you know that oral health is more than just teeth? It's more than just brushing and flossing. It's beyond that. When you go to your dentist, who, as many may not know, is your public health advocate. Yes, a dentist is a public health advocate. And when you go to the dentist is able, from viewing your mouth, able to tell you things about your heart health, your immune system, and your overall health right here in your mouth. And here is the crisis we are going to address today. Now, from this, we have heart health that could be discussed. We have immune system health. We have overall health, everything to do with the body. And this also affects your community health. And what do you mean affecting the community? Let's take, for example, we know that we're supposed to be at the dentist twice a year, general cleaning and checkup. But most people say, I brush and I floss at home. So they brush and they floss at home. But they don't realize what is happening. And so let's take this example. You go to bed, you wake up in the morning, and there's a pain that hits you. And it wakes you up and you're like, oh my gosh. The first thing you do is you call out of work. Then you call to get an appointment to see the dentist. You get to the dentist and the question is, when was your last appointment? In your mind, you're thinking, ooh, I never usually do those twice a year checkups. So you get it taken care of. But you don't think of the community impact. And let's see how it impacts the community. First, you called out of work. Obligation there has to be put off. Secondly, if you're a family person, then what about your obligation to your family? Picking up the kids, taking them to school for however many days this condition may have you laid up. Then there are personal obligations. This is your community, your work, your family, your personal obligations. Your health affects your community. So today we are going to address certain things that are often overlooked. We're going to simplify the conversation, and we're going to make sure that you understand that oral health, public health are closely joined. So come with me today and let's have this discussion, okay? Let's go. We're gonna see where we go from here. So as you can see, we're in the dentist office, and this is your dentist office. And so we're here with our hygienist, and we have a few questions for her. So normally, what do you see most? Children, elderly, or just adults?
We see a wide variety of different patients from the different age groups, but on an average day, probably just the average adult would be what we see mostly. Yeah.
The average adult. And when do you say would be the earliest to start dental hygiene?
So the earliest that we see patients is normally 1. So that's what the American Dental Association recommends, that you bring in your child by their first birthday. As far as home care, though, it's important to start as soon as they're born by just like wiping out their mouth with a damp washcloth to remove, bacteria from their mouth and kind of establish that routine at an early age.
And do you normally see disabled patients, children on the spectrum, disabled elderly?
Yes, we do actually.
Yes. Okay, so you recommend that it is something oral health is more than just teeth. It's your overall health.
Yes, for sure. It affects the whole body. So it's important for everybody to be seen every year and for their cleanings at least twice a year.
Thank you so much for talking with us. And as I said, let's continue the conversation. What we know we're going to delve into some facts. So, the fact here is inflammation and infection in the gums have been linked to serious conditions like heart disease, diabetes, and pregnancy complications. Then the CDC, which is the Centers for Disease Control and Prevention, say that for adults between ages 20 to 64, 1 in 5 of these adults have an untreated permanent tooth decay. Yes, permanent, which creates a chronic condition. Now, for children ages 6 to 9 years old, 50% of these children have cavities in their primary and permanent teeth. So we could understand that poor oral health contribute to 1.1 billion lost work days annually in the United States. This is not just a dental issue, I'm telling you. This is a national public health issue, and it's in your mouth. So the American Dental Association reports that oral disease are among the most common chronic conditions, yet they are largely preventable and largely ignored. So why are so many people still affected? Because we are not making our dental appointments. We don't know or probably don't understand. Sometimes we say, oh, I'm too busy. But we cannot be too busy for our own health, oral health, public health, and your dentist is here to advocate for you. So we want you to make your appointments twice a year. That's all it takes, and you'll probably be here in an office like this for a shorter time than you think. So go out and get your health taken care of. Visit your public health advocate. Visit your dentist and their team, and they will ensure that your health is your priority, their priority, and the community benefits. Let's continue walking, talking, and discussing the health crisis that's occurring in your mouth. So as the conversation transitions and we're here, we're on our walk, we're going to delve further into this condition, a condition of whether it is lack of understanding or just being acknowledgeably too busy. Nobody does say that oral health is not important. No, they don't. But I think what happens here is that a lot of people just get caught up in the daily routines, and so oral health gets pushed to the back of the conversation. And today what we want to do is we're going to highlight oral health, highlight advocacy, which is done through our dental team, and we'll continue with the conversations. Now, we know dentists do more than just clean our teeth and fill cavities. They are focused on prevention. They do a wonderful job at identifying small issues before they become something that can overwhelm our health or take us out of our daily routines. They also provide fluoride treatments, dental sealants, oral cancer screenings, and patient education. And a lot of people don't, when they hear cancer, they never think of cancer in an oral form. But oral cancer is definitely an issue. And as we said, your overall health can be identified from your mouth. Many dentists also advocate within the community by offering school-based dental screenings, free dental care events, public education campaigns, and this is a wonderful thing. A lot of times these things occur within the school districts in your neighborhood. They have free and low-cost dental campaigns and public education. The advocacy that dentists do can improve health policies, because as they go along and they find a need in their community, many government agencies or states, or if you call your sections parishes, when there is a need and a dentist advocates, then public policies can be changed. The costs that we incur, whether through our insurance or out of pocket, can be adjusted based on the work that goes in from the advocacy of dentists. So public health policy and dental advocacy also impacts how the community uses the services. And I want you all never to forget that. So it's important to get involved in your community and community advocacy because your health depends on it. Healthy communities start, as I said, with healthy families. It's a simple and powerful habit to practice with your children the hygiene routines. So they're going to brush twice daily with fluoride toothpaste, floss once a day at least, limit sugary snacks and drinks, schedule regular dentist visits, and as your hygienist told you previously, at least twice a year is acceptable because that gives them an opportunity to not just provide a service of cleaning, but do screenings and x-rays to identify potential risk or deal with things like cavities or sealants, So as we continue, you're going to make brushing fun, especially for children. They need their timers or you use music, colorful toothbrushes. These small habits and these things that we do on a daily basis for oral health can really redefine our general health. Now, we know that access to dental care, everyone knows this, is not equal and it's not easily accessible across all communities. And we'll discuss the barriers and the solutions. Now, some facts are 42 million US adults have no dental insurance. And a lot of people, when we mention statistics and we talk about people not having certain insurance or policies, they're like, how is that possible? But we understand that socioeconomic barriers do exist. And so it's important to advocate, and it's important that dentists and community advocates provide simple services. It's important to use and gain information that offer us, as we said in the previous video, that offers us solutions and gives us information, because you could live into a community where there are free dental checks every 2 months and you are not aware because it's not publicized. There are no campaigns. You don't know that you could take up the phone and call your information number and gain access to what is going on. And if you don't participate in community meetings, then you're at a disadvantage. And so we're trying to eliminate that disadvantage to ensure that you're able to access the care you need or know how to search for the people who have the information and can help you get the care you need. So 42 million US adults have no dental insurance. Low-income families with children experience 3 times more untreated cavities than higher income families. 3 times. So can you imagine a child going to school on a daily basis with a cavity? How can they focus? It impacts learning. It impacts the family, because a child who has a cavity and it cannot get treated and there's pain and there's infection, it keeps mom up at night. It keeps dad up at night trying to soothe and care for this child. It impacts the community. Your health impacts the community. Rural communities have 50% fewer dentists. So if you live in a densely populated area and you have access, a choice of 20 dental offices, in a rural community, that's broken in half. There's 10, and possibly not even that. You could have access to only 4 or 5. Now, we talk about barriers. What prevents a lot of people from accessing dental care is also things like cost, transportation, rural areas. How do you get to the dentist? If you don't have a car, if you don't have the financing to take public transportation or take an Uber or a Lyft, how do you get to the dentist? These things inevitably become barriers. So we'll say we have cost barriers, we have transportation barriers, and the shortage of providers for those within that rural area. Some solutions that we could have when it comes to these barriers, cost, transportation, location. We have, oh, here are the puppies. We have solutions that include community health clinics, mobile dental units. These are very useful in rural areas. And we find that these mobile dental clinics, they provide services for families, especially for the elderly. And so when we have these mobile clinics, this is where policy changes and advocacy comes into play. We want to have advocacy so that there are more funds allocated to these projects. We also have things like teledentistry service. Now, just like you have virtual visits where a lot of people see they advertise virtual doctor appointments, we have teledentistry services, which is, although it's not as new as virtual provider calls, it is not so much used or known. There are partnerships with schools and local organizations that are improving access to dental care and creating a better health equity among citizens. And that is the goal. We want you to understand that you are not without access to care, whether it's dental care or overall health care. You should feel that there is a service provided in your community. And if there is no service provided in your community, or if the service is in the least bit lacking, then this is where you call on your government officials. Your voice matters. Each voice matters. And just like big companies are able to lobby, or local community advocates are able to do lobbying when they see a professional need, just like your dentist is your local advocate for dental care. There is a need and they will advocate for you and lobby for you. But you have to seek out the care so that they know a community needs these services, because the dentist cannot stay in the office and know your needs until you get to his office. And that is what I want you to do. Do not be afraid to reach out to your local dentist and have a conversation with that office manager, because the team is there to ensure that the community is served. So we have to get back to the discussion. It's a beautiful day. It's cold, but the sky is beautiful. Look at all the foliage. So your mouth is not separate from your body. Taking care of your oral health is simple. And this is where we learn from our oral health and our dental team. We have to protect our overall health, and we are discussing it from an oral health perspective. Now, so far, if you've gained knowledge, if the video has changed the way you think about your smile, share it with someone. Please don't forget to like, leave a comment in the comment section, and subscribe. If you want practical science-based health insights that actually impact your life, this is where we are. This is what we are providing. Meaningful conversation with a topic that is simplified. So share it with others so that they may get the information as well. We're just getting started, and we want to bring awareness to health topics that truly matter. We want to be able to reach communities that are often overlooked. And so if you have an issue, if you think your community is overlooked, this is where we come to get the knowledge, have the conversation, and change how we view our own care. So I had a few questions that were posed to me, and these are the typical questions we usually see when I go to communities or I speak to patients about their health. And so we're going to discuss some of these questions. We're going to debunk some myths as well as we continue on our walk and our discussion. It's very important to understand that a healthier mouth means a healthier tomorrow. So we're going to look at some of these questions. I often get people asking, what are some ways to make dental care more accessible to underserved communities? And we've started that with this discussion we're having, with these posts that you're going to be sharing to your friends and family. This is the first step. Now, we know that the use of community health clinics, mobile dental units, telehealth services, and partnership with local organizations increase access to care. We've discussed that, we've said that. It's good to reiterate, to repeat ourselves. This will increase access to care. Now, government and insurance providers can also help, and they play an important part when it comes to costs. We want to make sure that the reduction of costs or the subsidization of care occurs in order to balance out equal access. Socioeconomic statuses, we need those things to be overlooked, because human health and human care is something that everyone is entitled to. The World Health Organization notes that every human is entitled to proper and convenient health care. And so this is the policies that we support, and we're trying to make sure each person understands you don't get care just because you can afford it. Care is your right. Health care is your right, and it should be made known and offered to everyone. Now, the other question is, how can parents encourage good oral health care for children? Repetition is important. You cannot just expect a child to see something once and know, okay, I'm going to brush my teeth twice a day. I'm going to floss when I brush my teeth. I'll drink water over soda. We have to teach them and then practice it with them. So we lead by example. Brush and floss together. Make it fun. Colorful toothpaste, play a little music, have a timer. Offer healthy snacks and fruits and vegetables. A lot of people don't understand that what we consume, the fruits and vegetables we consume, can help us in our daily stretch to achieving a better, healthier lifestyle. And we will also, a major part of it is our regular dental checkups. We don't want to wait until we have a crisis or until something hurts. A lot of people, they only see the dentist if something hurts. This is not what we're trying to achieve. I want you to be able to say, hey, let me go and check out my gums. We don't wait until they're bleeding. You don't wait until, like the example said, you woke up one morning and your mouth is just the worst place ever. It's like a volcano. That's not what we want. We want you to have preventative care and health maintenance. Now, there are some oral health myths that we want to debunk, and we want to prevent people from clinging to these myths, because these things can prevent you from accessing the care that you truly need and desire. And so we're going to note that myth one, You only need to see the dentist if you have a problem. We've spoken about this throughout this video. And the hygienist did say the recommendation is twice a year. Now, those basic 2 visits are for cleaning. But you know, once you go to clean, if you need to get sealed, if there's a cavity, if you need a root canal, all the services can be provided. But it has to start with those twice a year visits. And so I want you to believe in them. Instill them as part of your health routine and not to wait until you have a problem. The other thing is brushing harder means cleaner teeth. No such thing. You need gentle brushing with a fluoride toothpaste, which is most effective to protect your enamel and gums. So we don't want you to be brushing your teeth like you're scouring the bathroom. That will achieve nothing but damage your gums. We want you to use gentle strokes, and we need you to be brushing at least twice a day. And we need you to be flossing at least once a day. Okay? So the goal here is that we need to prioritize oral health and schedule our dental checkups. What we need is the prioritization of oral health and dental checkups. Now, before we close off, I want you to understand the importance of intake. Intake in terms of what we eat, what we drink. Harsh drinks like sodas can help to damage the enamel, damage your teeth. We want to also, everyone likes a soda every now and again, but what we want to also do is to ensure that we're drinking enough water. Drinking enough water will help to keep the mouth clean. Now, there are certain fruits and vegetables that go a long way to helping you maintain your oral health. And I'm going to give you a few just before we leave. So remember to eat fruits and vegetables to help keep healthy teeth. And we have things like strawberries. They're so delicious. Try not to add the sugar to it. We want to avoid adding sugar to stuff. We want to enjoy our strawberries in their most natural form. Bell peppers are wonderful. Onions, spinach, apples. So try to include a few of these in your diet. And let the children enjoy them too. I know a lot of parents want to cut apples and strawberries and bananas, and they want to add sugar to it. Try to stay away from adding the sugar. Get your fruits in their ripest form and practice having it. Include your fruits in your oatmeals. That is a delicious way to start the day as well. So we've learned something today. We've opened up to accepting the fact that a lot of times we get too busy for our health. And this is where we are going to slow down. Like we did the last video, we take a deep breath. The days can be heavy and hectic, but in order to serve yourself and embrace your community, we need you to embrace your health. Be mindful of your health. Let's stop this crisis that is occurring in our mouth by taking the time to not just take care of others, but take care of ourselves. You cannot pour into anyone else's cup without having something in your cup to pour from. Okay? So take a deep breath. Enjoy nature. It's a beautiful day. Thank you for coming out and taking this walk with me, having this discussion with me. And ahead of it, thank you for leaving a comment in the comment section. Share it with your family and friends and let me know how you feel about it. And as always, I want you guys to stay motivated. And I'll see you in the next video. Thank you so much. Isn't it a wonderful day? It's a good day to talk about health, to promote health. I'll see you soon. Bye.